Most people assume preparing for a baby begins the day you get a positive test, but biology works on a different schedule. To truly optimize your body for a developing fetus, you actually need a 3 to 6 month head start before you even try to conceive. Today, we are going to build your personalized 4-point preconception health audit. Go ahead and grab your medical records, a notepad, and a pen. We are going to create your action plan right now. By completing this audit, you are turning a passive biological event into a controlled process. Identifying risks early gives you the time to eliminate them before pregnancy even begins. Step 1 is establishing your physical baseline. Take a moment to calculate your current body mass index, or BMI, and write that number down at the top of your list. This scale shows the World Health Organization's optimal zone for entering pregnancy. You want your BMI to sit right here, between 18.5 and 24.9. This data table compares clinical pregnancy outcomes across different weight groups. If you enter pregnancy in the obese category, meaning a BMI over 30, the data shows a sharp increase in specific complications. Looking down at this row for total blood loss, you can see a statistically significant increase in hemorrhaging during delivery for the obese group, compared to those in the normal BMI range. Further down, the data highlights birth weights over 3,500 grams. Mothers with a high BMI face an elevated risk of delivering an exceptionally large baby, a condition called macrosomia, which severely complicates labor. If your number is outside the target zone, do not start a crash diet. Instead, use your 3 to 6 month window to make gradual, safe lifestyle adjustments. Getting your BMI into that optimal range before conception is a direct, measurable way to minimize severe delivery complications later. Step 2 requires your medical records. Check your vaccination history specifically for the MMR vaccine, which stands for measles, mumps, and rubella. If you contract the rubella virus during the first 12 weeks of pregnancy, it poses a severe threat to early fetal development. Early exposure often leads to congenital rubella syndrome, a condition that causes permanent birth defects, including deafness and heart anomalies. Here is the timeline trap. The MMR vaccine contains a live, weakened version of the virus. Because it is live, it absolutely cannot be administered once you are already pregnant. If you need a booster, you must observe a strict 4-week minimum waiting period after getting the shot before you can safely attempt to conceive. Scheduling your MMR vaccine early establishes an immunological firewall that protects your baby, without accidentally introducing the live virus to a developing fetus. Step 3 shifts our focus away from biology. Physical health is only half the equation. You also have to prepare for the practical and psychological demands of parenthood. On your notepad, write down 3 specific conversation prompts that you need to discuss with your partner this week. First, assess your external support system. Who exactly is available to help when the baby arrives? Second, outline a realistic division of household labor so expectations are clear from day 1. Third, audit your monthly budget. You need to verify that your finances can absorb upcoming costs like childcare and medical bills. If you skip these conversations, the resulting stress can destabilize your household just as rapidly as a physical health complication. Step 4 is creating your clinical strategy. We are going to draft a specific, itemized list of lab requests for you to hand to your doctor. Write down complete blood count, or CBC. This test identifies underlying anemia or low-level infections that could interfere with conception. Next, request a screening for hemoglobinopathies. This will reveal if you or your partner carry genetic traits that affect red blood cells. Finally, add a urinalysis. You want your doctor to check specifically for protein and glucose markers. Excess protein or glucose in your urine can expose silent biological threats, pointing to underlying kidney issues or undiagnosed diabetes long before other symptoms appear. Now that your list is ready, go ahead and call your healthcare provider to book a formal preconception counseling appointment. Walking into the clinic with this itemized list ensures you gather the exact data needed to preempt invisible medical risks before they threaten pregnancy. This checklist displays the 4 completed pillars of your audit: calculating your target BMI, verifying your MMR timeline, finalizing your household plan, and drafting your clinical lab list. Take this document directly to your doctor. It provides a clear, factual baseline for them to build your personalized medical guidance. From there, your physician will initiate the final steps, like prescribing prenatal vitamins with folic acid and safely adjusting any of your current medications. Congratulations! By taking the time to complete this audit today, you have successfully taken control of the critical variables that dictate a healthy pregnancy.